Welcome back. Agape Healthcare has set out to establish an organization that creates a higher standard for support care in our community. Autumn Rowland, Director of Palliative Care Services at Agape Healthcare, recently joined us. Take a look. Autumn, we're very honored to have you here today. Can we just start off with a big overreaching question, and that is really, what is palliative care and how does it work?
Yeah, so palliative care is actually a specialized branch of medicine. And so much like a cardiologist takes care of the heart and a pulmonologist takes care of the lungs, we actually specialize in the palliation of symptoms, which is a fancy term that means relief of symptoms or relief of the burden of symptoms. So essentially what we do is we are people that are very interested in making sure that people are comfortable and that they can manage their chronic disease or life-limiting illness. So I like to use a metaphor in palliative care or for palliative care in like where the chronic disease is like a suitcase. So if we take a suitcase and we open it up, there's many compartments there. That is what palliative care does. So I'm going to give you an example. Lung cancer as my suitcase or my chronic disease, if I open it up and I begin to unpack it, there are multiple things that are happening inside that suitcase and many compartments. So first one would be the symptoms related to lung cancer. So that could be shortness of breath, chest pain, breathlessness, pain within the entire thoracic region, things of those types and symptoms of those types. So we certainly prescribe medications to help with those symptoms and relieve the burden of symptoms. We also do non-pharmacological things like pursed lip breathing to help and resting in between activities. If I go back to that suitcase or that disease process of lung cancer, I look in there and I see there's modalities of treatment that are being offered. So when I look at that, a lot of those modalities of care, like chemotherapy, radiation, immunotherapies, also have side effects and symptoms that are related. So if you think about chemotherapy causing nausea or vomiting, or diarrhea, things like that. So we certainly manage those as well with medications and different modalities of care. If I go back to my suitcase, then I look in there and I see there's an emotional component of the care. So what is this chronic disease doing to the emotions and the emotional concept of that individual? Is it taking its toll with depression, anxiety? Are we looking at the loss and not only the big picture of loss, but everyday loss? Does this person like to take a bike ride of 20 miles a day and can no longer do that today, whereas yesterday they could? So really going along that trajectory or pattern of disease and starting to really unpack all of those pieces. Looking at the differences in goals of care. If this were to happen, then what would you like? And giving that control back to the patient. And really looking ahead and knowing these chronic diseases and knowing what could be around that corner is really an important part of palliative care as well.
I want to go, you provide palliative care and then hospice. What's the difference between both of those? Because a lot of people don't know the distinction.
Sure. So hospice actually also is very symptom management related, so they certainly provide palliative, but we also provide end-of-life care. So the difference is that there must be a prognosis of 6 months or less to live in order to have that benefit. So it's a type of healthcare as well, and it is provided in those last 6 months. It's also a bit broader in that it provides also a CNA, which is a certified nurse's assistant to help with cares, also a social worker and a chaplain, also a nursing care who can do wound care and call me for orders and things like that. So it's kind of the whole enchilada.
Yeah.
We're also available 24 hours a day, 7 days a week for questions. So if at 3 o'clock in the morning a patient had a symptom, you can call, we can send a nurse out to visit, all of those things with hospice.
All right, this is important too because a lot of people, their lives hinge on it, and that is, how is it paid for?
So insurance picks up both programs.
Okay.
So palliative care is billed just like a doctor's office visit. And so when we come out, that is how that's billed, and insurance picks that up. Might be a copay, may not be a copay, depending. Hospice is covered by every major insurance company at 100%.
Autumn, we love having you here. When you talk about these, you're so passionate about it. And for those of us, we almost started crying before we started talking, just talking about those in our lives who have needed this type of care before. So it doesn't go unrecognized just how important that you have, the job that you have and the passion that you have for it. So thank you so much for being with us. If you or a family member is in need of palliative or hospice care, don't hesitate to call Agape at 720-482-1988. You can visit their website at agape-healthcare.com for more information. They paid for today's segment.